Special guest on the program this morning is Dr. Rakesh Mohanlall, an international leader in healthcare. He has already helped many of our listeners who were sick to get well to ensure a good quality of life with early detection and treatment when all else had failed. So Dr. Mohanlall holds many accolades and is a doctor of clinical technology specializing in cardiovascular perfusion and non-invasive integrated medicine. Today, he also leads the way in non-invasive healthcare technologies in the world. He's been trained in South Africa and in many other countries globally, right? On many advanced technologies. Dr. Mohanlall, good morning to you, sir. Welcome to the program.
Good morning. Nice to be on the show again. And for the first time on Facebook, I tried to shy away from this for many years, but my family and my friends and patients have always been pushing for it. So
Yep.
here it goes.
We have to move, as you have been doing in your practice, we have to move with technology and advance with technology as it goes. And
I
here we
agree.
are together. It is a first for these interviews. Now, Doc, as we've mentioned to our listeners in the past, the Heart and Healthcare Center, which is situated in Durban North, offers non-invasive healthcare. Now, non-invasive healthcare, this seems to be a hot topic of discussion at the moment. Please enlighten us on what this means, non-invasive healthcare.
Well, as the word suggests, non-invasive in medicine means that a procedure is done that does not require cutting, it does not require breaking the skin or insertion of an object into an opening of the body. So non-invasive medicine or healthcare does not include any equipment or device that literally cuts open the skin and physically enters the body in order to treat an illness. Remember that these procedures are non-intrusive to the structure of the body. It is non-disturbing to the organs and systems. It is non-interfering to any part of the body, and it is non-imposing. That means it does not change the physiology of the body in any way. So these are the important things that one has to remember when it comes to non-invasive treatments and modalities.
Absolutely. So, taking that information into account, what then is invasive procedures?
Well, invasive procedures are procedures that we cut open the body literally, where a device is used to open the skin, get into the system, either a device or a blade or a needle or a device like an angle grinder or a jigsaw system that are opening the body and getting into the body to try and alleviate some sort of problem. For example, during a scope, the scope is used where camera is in a scope. We enter the body either through the mouth in a endoscopy, or through the anus in an endoscopy, in order to try and find some changes in the structure of the system. Remember that this is a good technique, but it can only identify something in its advanced stages. So to pick up cancer in the early stages, or to pick up an ulcer in the early stage, or to pick up bacteria, so on and so forth, you will not be able to pick it up. Then a biopsy is where we use a needle to go into abnormal tissue, like in a tumor, and try and sample a piece of the tissue so that we can send it for further testing. Now we know that tumor is basically a collection of chemicals in the body that has been encapsulated so that it does not spread, or a collection of abnormal cells that have been encapsulated in order for it not to spread and attack another part of the body. When we biopsy a tumor, we literally make a hole, we puncture the tumor. When we puncture the tumor, the chemicals or the toxins that's inside the tumor leaches out into the surrounding tissue. And so does the cancerous tissue. So the chances of poisoning the rest of the area around it or making it cancerous is quite high by doing a biopsy. So this system was an old system that we used to use, and we seem to be moving away from it. And the more advanced doctors will definitely move away from it. In terms of surgery, what we do is we cut open the skin using a blade initially. We have something like a soldering iron, literally, that burns the tissue and stops bleeding if necessary. So we literally burn the flesh and stop the bleeding where needed. From there, for example, in heart surgery, we then use a device that looks like similar to an angle grinder or a jigsaw to cut open the sternal bone so we can then get access to the heart. When we're into the heart area, for example, then we use a blade to cut in through the heart if we need it, like in a valve replacement. Or if we're in any other part of the body, we literally be able to use the blade to cut and join our equipment to the body. Remember that this is in an attempt to solve a problem. There's no guarantees that after surgery that the patient would be fine. Remember that the patient goes in during surgery for chest pain, shortness of breath, and so on and so
Mhm.
forth. When they come out, they should not have shortness of breath. They should not have chest pains. My
Yes.
argument is that if you say a patient went in for surgery and came out alive and that was a success, did he go in dead? Because if he went in dead and came out alive, then that's a success. So we
Right.
do not define success as coming out alive out of surgery.
Doc, what are the medical benefits of non-invasive procedures?
Well, there's reduced risk. There's no infections. There's no
Mhm,
hospital stay. Uh, there's minimal downtime because people
mhm,
obviously want to get back to work. It's faster test results. You don't have to wait for results 2 or 3 days later. There's no
mhm,
scarring. There's no loss of income. There's quick recovery. And remember, there's better cosmetic results. We can do multiple tests at one time. So we do not have to do one test, wait for the test to be complete, wait for you to recover and start the next test. We can test every organ in the body
mm,
simultaneously. This is very important because it's time consuming to wait for tests and then to wait for test results, and then it comes back negative, and then you start the procedure all over again, looking at another part of the body to test it invasively, cut it
mhm.
up, and then find out there's nothing wrong with that. It's like a mechanic trying to fix a car by replacing every part of the car. Whereas in non-invasive treatments, there's less effects to the body, it's faster and more effective.
Burning question at the moment, after all of this information that you brought through. When should surgery be used?
Well, surgery is very important in emergency cases or in trauma cases where there's motor vehicle accidents, for example. You cannot wait for the body to heal. You need immediate intervention.
Mhm.
Also, in removal of certain tumors, where the entire tumor is removed at one time. And surgery should be reserved when all else fails. If you injure your finger and a plaster or stitch can be put on in order for you to heal, would you look
Mm.
at cutting the finger off first?
Not me. I definitely wouldn't.
So this is the whole point, that you should go
Mm.
for minimally invasive first and leave surgery as a last resort.
Why should patients opt for non-invasive tests and procedures first?
Well, as the word non-invasive means, there's no
Mm,
tissue removed from your body. We're not cutting into the body. There's no pain. There's no suffering. People suffer a lot with surgery. We know that. There's little or no recovery time. As I said,
mhm,
it's more cost effective. One can look at this because it's more appealing to business people as they don't want the downtime. You go for
mhm,
the
mhm.
procedure, you go back to work the same day. There's no downtime, and I'm sure your employers will want the same thing as well. There's little or no chance of infection, and this is due to surgical intervention. And remember that today, hospital-borne infections are very common. We see it in most patients. Many patients don't even die of the surgery, they die of the infection in the hospital. So there's less risk of hospital-borne infections. There's less risk of disability after surgery. Imagine you go for a spinal procedure, walking, and you finish off paralyzed. I mean, we've seen so many patients of that even came here and that were convinced to go for a spinal procedure because of slight back pain and finish off paralyzed even till today. And it's so sad to see. Well, there's also a very low risk of death, which I'm sure is important to most patients. So these are the advantages of non-invasive.
We've got a couple of questions coming through from our listeners, and I do see it. And I want to remind everybody that at the end of the discussion, we'll be giving you Dr. Mohanlal's contact details. So, pen, paper, tablet, whatever it may be you need to take down those details, have it ready. At the end of the discussion, we'll be giving that information to you. So, stick around for that. Doc, one more question. Can you give us some examples of non invasive tests and procedures that you currently offer at the Heart and Healthcare Center?
Well, we have quite a few of non-invasive modalities, but the four I'd like to focus on that may affect the listeners right now is the full body screening test,
Mm-hmm.
um, the comprehensive cardiovascular diagnostic test, the cardiac echo, and our treatment known as external counterpulsation, which we spoke about in the show before.
So now I'm sure listeners are anxious to hear what all of these entail. So we'll go through them, just one at a time. And if you can educate us on what each modality does and how we can, decide what appointment to book for. So let's start with the full body biofeedback screen test.
Well, that's a best place to start for anybody, Nishal, because one wants to know, even if they have no symptoms, what's actually happening to the body at any given time. The rest of us are either unfortunate and already symptomatic, so they can still do this test to identify what stage of the disease they are in and what modalities we can use to treat them. The full body scan is a very advanced screening test which screens every part of the body to assist with detection and management of disease. We place some devices on the patients so they're not put into a drum, which many patients are afraid of, like an MRI. We place devices on the patient, it's very comfortable. They will be able to see on the screen what we are testing. It tests every part of the body, every organ. So we look at changes in the functionality of the organs so we can decide what modality of treatment or medications they require. It has a very high sensitivity and accuracy of over 90%. So we can test every organ and system in the body at one go. We'll test the heart, the lungs, the kidneys, the pancreas, the spleen, the urinary tract, looking for infections. We can test every vertebrae of the spine, every bone of the body, the entire lymphatic system. We can look at, for example, if the kidneys are malfunctioning, why they're malfunctioning, the gastrointestinal system, which is the gut, which we seem to be having a lot of patients having problems with that today because of either some sort of ulcer, erosive gastritis, or constipation, bloating, any cause of gastrointestinal problem. We should be able to identify that. We identify bacteria, worms, microorganisms, and parasites in any part of the body, and it'll show you the degree of acidity in the body. Nishal, this is the must for every family, every baby from 3-year-old to the great grandparents. We have a very high success rate, and it's actually shocking when patients sit here and are so taken aback by how much of information the test can give you and how accurate it is.
Absolutely. As we get closer to news today, this is news for you. That's watching the video. And the news I'm talking about is all of this non-invasive medical procedures that we're talking about on the show right now. The video will stay on YouTube. It'll stay on Facebook, so you can always come back, watch and listen again if there's something that you missed. And a reminder that we'll be giving out doctors' details in a little bit. So get your pen and whatever ready. Doc, you mentioned three-dimensional vasculography, or the short version, 3DVG. What is it?
This is a test that should catch the eye of or the ears of most listeners who have heart problems or have family members with heart problems. This is the most advanced cardiovascular non-invasive diagnostic in the world. It'll show us blood flow to every part of the body. It'll screen the heart, the blood vessels, the heart, the lungs, the kidneys. It'll show us fluid retention in the lungs at an early stage. It'll show us the kidney function in actual form. It analyzes your risk profile for heart attacks, strokes. So there's no dyes injected into the body like with angiography, for example. So there's no side effects to the kidneys. You don't get blind, or the chances of being blind after the procedure is non-existent. And basically, there's no chance of kidney failure, heart failure, or any sort of failure after a scan like this. And as I said again, it's the only test in the world that will give you blood flow in the heart, around the heart, in the coronaries. So it's a very important test for patients who have heart problems, to be done before surgery or after surgery to define whether they need surgery or not, or if the surgery or stent has been successful or not.
Indeed. Cardiac echo?
The cardiac echo is the test that most of the people undergo, similar to what you do for a scan for a baby. It'll scan the heart. We look inside the heart, look for blood clots in the heart, look for changes in the function of the valves, whether they are leaking or not, and the power of the heart as well. So this is a good comprehensive test of looking inside the heart itself.
Indeed. Now, we know that ECP is something that is, not brand new, but still young in the country. But ECP is something that you're pioneering in the country. So tell us about external counterpulsation.
Well, external counterpulsation has been out there from the 1970s. We started the program in South Africa in 2010. We've done
Mm,
thousands of patients successfully. We are the only registered center in South Africa with the Health Professions Council. We are the only
mhm.
people qualified to do it. So it's dangerous to do this treatment if you are not qualified, even if it's non-invasive.
Right.
External counterpulsation is where we use devices that we place on the patient that increases blood flow to every part of the body. It increases blood flow to the heart. It alleviates shortness of breath, chest pains, um, uh, fatigue, tiredness, patients who cannot sleep at night. So it will help in everything that you see in patients that have heart problems. It bypasses the heart naturally by
Yeah.
opening the collaterals. So we give new blood flow to the part of the heart. It's very, very effective in heart patients, in cardiac failure patients. That means we've been through everything and all else fails. And the doctor
Yeah.
said, go home and die peacefully. We'll be able to take over at that stage. It's very effective in Parkinson's, stroke patients, as I say, in patients who have problems with blood flow, even after COVID-19 and after the vaccine, it's
Mm.
very effective treatment.
Okay, Doc, let's go through just one or two really quick WhatsApp messages that are coming through from our listeners. Sister says, I've had a cyst removed in recovery. What treatment can Doc offer me for wound recovery? I have an open wound.
Well, we've
Have
done
you?
some amazing cases with external counterpulsation, and it's a pity. I should have shown you on on YouTube, but you won't be able to see it over the phone. I mean, over radio, obviously.
Yes.
But fantastic cases where the entire bottom part of the leg was debrined. That means the tissue was resected after injury. It took 1 year, and the patient didn't heal. It was
Mm.
completely full of pus and
Yes.
completely decaying. After
Right.
ECP, after 2 months, it is completely healed. So in tissue
Wow.
recovery, what you need is oxygen and you need blood flow. And our three-dimensional test, I mean, our biofeedback test should be able to tell us what's happening in that area before we treat the patient.
Indeed. Quite a few people want to know about medical aid. The treatments that you're doing, are they covered under medical aid? Is there a procedure for that? How does it work?
Actually, medical aid, we still busy with the medical aid for the biofeedback and so on and so forth. The only
Yeah.
treatment that's paid for by medical aid is external pulsation. And those are only for cardiac failure patients. And the medical aid will only pay under my name under a special code that's been allocated to us because we're the only people that's qualified to do this treatment.
Indeed. So messages coming up on screen that people are sending through right now. We can see those as well. Thank you very much to those folks that have been watching. Here's your chance now to write down details to contact the Heart and Healthcare Center. Doc, if you could let our listeners know how to contact you or your practice in order to benefit from the expertise. And I know I always ask, so I'll try again. Are there any specials?
Well, yesterday was World Heart Day, and I'm the founder of the International ECP Association. It's an international
Right.
association of over 195 doctors. And one of the things we said we will offer our people back home is a 20% discount on the biofeedback test, because that's a place everybody would want to start. So just for now, a 20% discount on the biofeedback test for the next week, if as long as your bookings are done in the next week. So we
1
will
week.
do the test at 20% discount. And that is a great test for you to start. Our phone number, we are located in Durban North, near Broadway. Our contact details is 031
Mhm.
563 0419. It's 031 563 0419 at the Heart and Healthcare Center in Broadway, Durban North.
Doc, I want to thank you for bringing this information to our listeners once again. To everybody who's listening in, and maybe you didn't have a chance to write it down, remember you have to telephone to make your booking. It's 031 563 0419. The line's gonna get busy.
That's
There's only my
your
fault. I'll
first
take
call
the
is already here. Your first call is here already, Nishal.
look at that. I'm gonna take
The
the
phone is
question.
already rung, literally.
There you go. So I'm going to say to you that's trying to call in right now, it's 031 563 0419. There's only one receptionist, right? So let's give her a chance. The phone will ring. She's going to answer it. She's going to have a convo with you and she's going to write down your name, date, and appointment. It's going to take
Take
a
a little
moment.
time.
So If you don't get through right now, try again a little bit later on. You got the number. Dr. Rakesh Mohanlall out in Durban North at the Heart and Healthcare Center. Sir, thank you very much for your time this morning.
Thank you. Thanks to all the listeners. It's wonderful being on the show. Thank you, Nishal, and your team.
Have a blessed
Okay.
day.
Okay, thank you.
And that's